13th, 5 o'clock p.m. We'll do a roll call.
Kathy Leaf.
Here.
Kara Cook is excused.
Excused.
Dave Osnes. Scotty Yard. Greg Telejohn.
Greg?
Paulette Anderson.
Here.
Deb Lindeman.
Here.
Natasha Ward.
Here.
Paul McGinnis.
I'm here.
Okay, thank you, and welcome everyone. We'll have approval of the minutes. If everyone's seen them, if there's any discrepancies, changes. Seeing none, we'll still be moved as, we'll do stand as written. Public comment. We do have one email that came in from John Strom. It'll be presented into the record. You can read it later in the minutes. Next, business items. First is the election of Health and Human Services Board Chair.
Paulette, this is Pat Thompson.
Yes.
Can you hear me?
I can.
Hello, Supervisor Anderson, members of the Health and Human Services Board. At this point, I would like to, before you get into your business items, I would like to introduce Mr. Rort, Bob Rort, who is on the line attending the meeting. Bob will be beginning his duties as Health and Human Services Director on June 8th. And I'm glad you could join us this evening, Bob. And before we begin our business items, I'd like to just have you introduce yourself to the Health and Human Services Board. Your appointment has been confirmed by the County Board of Supervisors at their last meeting. So you are officially appointed as director, although you won't begin your duties until June 8th. And also Fred Johnson is in attendance this evening, and Fred will be with us until June 19th. So welcome, Bob, and say a few words, if you can, for the Health and Human Services Board. Introduce yourself. Thank you.
Sure. Thank you, Pat. Good evening, everybody. And I just want to say quickly how happy I am to be a part of St. Croix County. And I look forward to working with all of you, learning from all of you. And I know, as Pat has said in the past, I have big shoes to fill, but I'm looking forward to jumping in with both feet and hoping that I can be a resource for all of you as well. Thank you.
Thank you, Bob, and welcome.
Thank you, Bob.
Anything else, Pat?
No, not yet. Thank you very much, though, for your indulgence.
Okay.
If I can just personally welcome Bob, look forward to the 2-week overlap that we'll have. I'll do whatever I can to help support in this transition, and you've got a great board to work with, a great staff, so looking forward to maybe having more opportunity to interact with you via Zoom or business Skype, and maybe we'll get a chance to meet in person. But welcome, Bob.
Thank you.
Okay, thank you. And again, welcome, Bob.
Thank you.
Okay, the first order of business is election of the Health and Human Services Board Chair, and I'll open up the nominations for the chair.
I have a nomination.
Deb?
I would like to nominate Supervisor Dave Osnes.
Okay, we have first nomination for Dave Osnes. Any more nominations? Second time. Any more nominations and a third? Okay, with only one nomination, I'll ask for a motion.
I would move to approve the nomination.
Scotty's motion. A second?
Second.
Second.
Okay, Dr. McGinnis, second. All in favor for unanimous ballot for Supervisor Asmus to be chair of the HH board? Voice vote.
Aye.
Opposed? Unanimous? Supervisor Asmus now takes over. Thank you.
Thank you, Paulette, and thank you, everyone. First of all, I too would like to welcome Bob on board. It's nice to see you again, sir. And we look forward to working with you. Don't be afraid to scream and holler at us. And we do a pretty good job, as Fred knows. We tend to scream and holler a little bit too. Not real loud, but we do. And with that, we will move on to the election of our board vice chair. Is anyone wishing to make a nomination for vice chair? Second call, is there anyone wishing to make a motion for vice chair?
I would nominate Supervisor Paulette Anderson.
Okay, any other nominations? I'll close the nominations and ask for a motion for unanimous consent for Paulette as vice chair. All those in favor say aye.
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 Okay. You want to make a motion?
I would move to approve a unanimous vote.
Now all those in favor say aye. Aye.
Aye.
Opposed? Okay. Paulette, congratulations. We'll go right into establishing a schedule of our Health and Human Services Board. In the past, we normally met on the second Wednesday of the month. Curt, who's also on the board, has a conflict that meets on the second Wednesday. Admin committee is asked that as many as possible of the standing committees meet the third week of the month. And so we would be looking at moving our meeting to the third Wednesday of the month. Does anybody have any objection to moving to the third Wednesday?
I would move to approve moving HHS to the third Wednesday of the month.
I'll second it.
Okay. All in favor of moving to the third Wednesday of the month, say aye.
Aye.
Anybody? Deb, did you want to say something?
No?
Okay.
I think I said enough.
Anyone opposed to moving to that third Wednesday? Okay, thank you very much.
Chair Asmus, real quickly, will that be at 5 p.m. then? Is that the same time for the board to meet?
Yes, that's correct. So it'll be the third Wednesday of the month, 5 o'clock, and we will be meeting here or on Zoom as we move forward. Okay? Okay, we're going to move on to item number 4 with a Corona report. Kelly.
Good evening. Welcome, new board members, and welcome, Bob. I see that you have a master's in public health, and I couldn't be more excited about that. I'm looking forward to working with you and your experiences you've had, and can't wait. So we thought it was appropriate that we update you guys on the COVID-19 response efforts that are going on in our county. Next slide. Who put the fade on this? I did not do this. This is too slow. Okay, So at this time, because there are very limited treatments and no vaccine for COVID-19, we continue to encourage public health recommendations of non-pharmaceutical interventions. Lots of stuff you're seeing, hopefully anywhere you do go and venture out, all these good personal behavior messages, environmental messages, as well as social distancing. As we know, this is becoming harder and harder as we're into month 2 of this response. Next slide, please. Oh my goodness. So for the new board members, I wanted to make sure you guys had a little bit of background about public health, and I'll go into some statute language in a little bit here, but one of the things that we are very proud of here at Public Health, and Deb Lindeman, board member, is a big part of this, is we are a nationally accredited health department. That might not seem like a big deal, but this process is kind of grueling. No, not kind of, it's very grueling. It's painstaking, it's a lot of work, but the 89,000 odd some residents of St. Croix County do have a local health department infrastructure that is accredited by FAB. These are some of the functions. I know the title of this slide says, what are public health core functions in an outbreak? I just want you guys to know that these are also core functions of how we operate on a daily basis regarding if we are in an outbreak situation or not. We do a lot of these things that you'll learn more about as we move on with our time together. Next slide, please. Now we can get a little bit more specific related to communicable disease control. I sometimes joke with people and say, yeah, in the state of Wisconsin, public health is, there is job security in public health because fortunately, and maybe unfortunately at times, we are written right into the state statutes and have administrative rules to follow related to specifically communicable disease control, there are other areas of focus too, but today we want to focus specifically on communicable disease control. So these are some of the duties outlined that a local health officer must do. Prompt measures necessary to prevent, suppress, and control the spread of disease. And we must do what's reasonably necessary for prevention and suppression of disease. We may forbid public gatherings when deemed necessary. And unfortunately, we are looking at a situation that local orders may need to be written given ruling in the courts and how things are going. I want everyone on this board to know I have always been brought up and taught, public health, we didn't go into our job to be authoritative. We are not looking to be punitive with people. We obviously want to do our work through education and cooperation with anybody we're working with, whether individuals or businesses. So I want everybody to hear that. That's how our department really does do business. It's not a punitive, although we do have authority for citations, as you can see defined by Chapter 252. That's not something we would like to utilize. Administrative Rule 145, just highlighting some of these important rules, really talks about reporting of communicable diseases. And I think we need to do a better job as public health practitioners, really telling a variety of partners on how important reportable or communicable disease reporting really is. We're seeing it now more than ever as we continue through this COVID response. And we've seen some struggles, and I've shared with Chair Osnes related to the river. The river is one of our problems, and we saw that firsthand again today with a positive case that was diagnosed in Minnesota on May 1st, and we found out about it today. Well, we are 14 days into a quarantine, and this is the first contact that we had with a positive case living in our county. We were fortunate. I don't want that to be alarming to people. We were fortunate the situation didn't get out of control, but just be aware there are issues. So roles of Health and Human Services Board in communicable disease, we believe, and this these bullets come right from the DHS website. Assure measures are taken to provide an environment which individuals can be healthy, assess public health needs, and advocate for the provision of reasonable, I stress reasonable and necessary public health services, provide leadership that emphasize public health needs and equitable distribution of public health resources, and assure the enforcement of state public health statutes and public health rules. Again, those are some chapters. If you're interested in looking up, you just Google Wisconsin state statutes, and there is a variety of information there. Not a lot of people find pleasure in reading statutes, but some do. I know it was a big help to me in learning the role of the health officer years ago. So next slide, please.
Kelly, I've got a question if you don't mind.
You bet.
It's one, and like you said, you and I have talked a lot about what's going on across the river and the challenges that we have, even with the immunizations and who's been vaccinated and who hasn't been vaccinated, and how we get that information from Minnesota back here to Wisconsin and eventually back down to St. Croix County. Are we going to have that kind of an issue with the virus, do you think, as well?
So let me see if I understand the question. So I know former public health supervisor, nursing supervisor Sharon Razor did a ton of work with Minnesota and their immunization registry to talk with ours. So I think we still do continue to see problems, but as far as reporting of communicable diseases, we are seeing problems. They're few and far between. I can probably count on one hand the more egregious situations where we didn't get a timely report of a positive COVID test. And you know, I did go up the chain and I did ask questions of the state and I did ask questions of MDH. And it is, I even reached out to old professors at the U of M to try to find out some answers related to this problem related to the reporting. So we'll continue to work through that. So I don't know if that answers your question. I don't know if you're referring to when we get a vaccine for COVID, if that will become an issue. Sorry if that didn't answer your question.
No, that was a good job. I think my question is if somebody is tested positive and they went to a doctor or their family is treated by a doctor in Minnesota, that case is tested positive. Does that go to CDC, which eventually dumps down to DHS, which eventually dumps down to St. Croix County? Or what is that process?
Yep, the way I understand the process is supposed to work, those local clinics and hospitals in the state of Minnesota report to MDH. So that's their state health department. And remember, they're kind of the leaders in Minnesota. They're a centralized ran public health system where Wisconsin is not. We are decentralized. The work and the stuff, the public health interventions really get done at the local level. So my understanding is clinics report to MDH. MDH then doesn't report to local public health departments. They report to our Wisconsin State Health Department, and then they figure out how to report to us. And a lot of this is done through our Wisconsin Electronic Disease Surveillance System, which is WEDS, that many Minnesota providers do have access to. And I have been on the phone several times with quality improvement staff within the different health organizations, health partners. I will be chatting with Fairview. So yeah, sorry, but that's a long-winded answer to, we're trying to make that process more seamless.
Okay, thank you.
County numbers right now, we actually do have 37 positives. This slide was updated yesterday afternoon. Of those 37 positives, 17 have recovered, which is a slight update. Because there are some new people. I know I never know who I'm always talking to and who knows what. So probable cases are defined as close contacts and household contacts who become symptomatic and were exposed to a person with a positive test. And of those, we have 27 of those. So this slide really has, it changed a lot in a day in just the over 2-day period, which 14 of those have recovered. We currently have 0 deaths related to COVID. We've had a couple instances where our wonderful medical examiner, Senator Schottner, I shouldn't refer to her as senator when I'm talking in the medical examiner lens, but she and I have a very slick process worked out that if she does suspect COVID, public health comes to the scene and we do the test. Because her bodies right now, her dead bodies go to Minnesota for autopsy. And before Minnesota kind of lifted their restrictions on testing, we were getting turned down. We were getting turned down for COVID tests on suspect patients that we were suspicious about. So we figured out a way to circumvent that and are moving forward with that. Just one other note on this slide before I have you change to the next one. We did receive our first positive antibody test today. I'm not going to talk a ton about antibody testing. I think Dr. McGinnis can absolutely jump in if he wants to. The Wisconsin Public Health response has not incorporated antibody testing into this process yet. A little too new, little too many emergency authorization acts that went through, really not using antibodies, can't use antibodies for a diagnostic criteria. And it likely will help us months out in the future as we look for people who may be able to donate, and be part of treatment in related to COVID treatment. But at this point, we're not there. Next slide.
Dr. McGinnis, do you have anything you want to add at this point?
No, I think Kelly covered the question around the testing very well.
Okay, thank you.
Thanks, Dr. McGinnis. So Pat, Administrator Thompson, I hope you're happy with this curve. It's not super aesthetically pleasing right now, but we're going to work on that. And I thought I could share it with this group because you guys will forgive me, I'm sure.
I think it looks good, Kelly.
So this is kind of our St. Croix County curve. These are when we had the vertical lines represent dates of which we received. Oh no, I'm sorry. The bottom are the dates of the positives, when positive cases came to us. And the curve just goes up. And I don't believe we have, we're missing 2 on here. You can't really tell where it stops, but you can see that, we are in an acceleration phase of the pandemic. We are not at a point where I think we can continue to go out and the curve may not flatten right away. It's hard to predict some of this. Wish we had a crystal ball. Any questions related to that?
Kelly, just a comment.
Yes.
The curve is increasing fairly markedly, and I think the key data point that eventually will become more and more useful is the percent of positive tests. So in other words, out of how many tests have been done, how many of those were positive? Because one of the things is this is really maybe just representing the fact that we're able to test a lot more folks. And so it may not mean that the infection is has spread more widely in our county. It just may now represent that we're beginning to find where these cases actually are. And it may have been this high in the past, we just don't know. So that percent of positive number becomes important in this situation simply because we weren't doing a lot of testing back in March and April. The capability was not there. And the capability now, very different, many more tests being done, and that's going to continue to change, I think, as the month goes by.
You bet. Great point. Next slide. So we just wanted to highlight a few things that we thought you may be interested in related to the response of COVID. And I think it is important to point out that on January 27th, we got our first call from the state from a traveler who had just returned from Wuhan, China, and got us all very excited about, wow, COVID's here already. Luckily, this person complied greatly, did symptom monitoring for 14 days, and was tested for COVID and did not have COVID. So we were very happy about that, but I just want you to kind of know, we started this way back in January and it didn't really accelerate for us until March. We opened our emergency operations center with the help of emergency management. Natasha and her crew in ESS have been fantastic. We're regularly meeting with community partners. I am on the phone at least twice a week with Corp Counsel, and even more now as we get into issues of expiring orders and court cases, law enforcement and DA. Also talking with community partners. We've been invited to several local community meetings in New Richmond, Hudson, and the latest was yesterday. AZ Snyder and I, health officer for Pierce County, presented for the River Falls City Council last night. We were on for 90 minutes. They had a lot of questions for us, but I think it was a really good use of time and got them up to speed. So we have done 200, I know this number is wrong because I know what it is. We have done more than 225 COVID investigations. Deb, you don't happen to have the high overlevel view or the high overlevel sheet at your disposal, do you? We can get you an updated number on that.
Here, I can try to pull it up here. I have to minimize get out of this a minute and then, yeah, I'll find it.
Yeah. So, and this slide was actually updated for the county board supervisors meeting. So that was over a week ago. And at that time we had 455 phone calls, 133 of those which were related specifically to the safer at home order. And we've done I think a fairly decent job in our health department at tasking people to their strengths and what they're good at. And what we've done is put our sanitarians and our public health supervisor, Lori Diaby, has been fantastic and fabulous about really taking on business questions, even individuals' questions related to safer at home. And then one of my most proudest accomplishments, I know we heard we need to get testing. And in a very short time, the state of Wisconsin announced that the Wisconsin National Guard would be a deployable resource to communities who needed more testing. And that happened for us Friday, May 8th in Baldwin, where 229 tests were completed, and on May 9th in River Falls, where 184 were completed. So we were happy to get that resource out to our community. Just a note for our Baldwin facility testing site, we did have 4 positives result from that testing site. I think my prediction of 10% was too high, but it was a guess. So next slide, please. Deb, did you find that number about the?
I'm sorry, I can't find it. Hang on.
No worries. No worries. I didn't mean to put you on the spot.
Apparently I'm muted, and so.
It's okay. Here are a couple pictures I just wanted to share. Ooh, that is the wrong picture. So please just erase this first picture from your memory. But we had people lining up. Our test time started at 11 o'clock and went till 7 o'clock, so 11 a.m. to 7 p.m. And we had people lined up just after 9, and they sat there for 2 hours. And most of our people that were lined up that early did not have appointments. So we figured out quickly a way to get those people tested, even though they didn't have an appointment, with the guard in doing a 3-to-1 ratio on cars who had appointments and cars who didn't. So we were happy. We hope that everyone who wanted a test that day and was planning on it got one. We had a big thank you to Western Wisconsin Health, as they provided meals for the National Guard, both lunch and pizzas for supper. It was amazing. CEO Allison Page came down and chatted with media alongside me, and came in and said hi to the Guard, and offered them cloth masks that they took with them. And it was just this is what public health in my mind is all about. Lots of partners involved. Big thanks to all those partners listed. To Highway come out with cones the day before, as well as the local law enforcement, as well as sheriff had a deputy on site through the duration of the very cold day on Friday. Next slide, please. I'm so sorry, it's so slow. So I thought we would talk a little bit about Badger Bounce Back Plan. I think we're planning 2 at the county level. I'm certainly getting lots of questions from community members, chambers, about when we can reopen. I just wanted to share this infographic from the DHS website about boxing in COVID. This has been kind of a term they're coining, I guess, about the things we really need to keep in mind. We know we can't keep people home forever. My hearts, and I said this on the call with River Falls last night, my hearts really do go out to small business owners who may not even be able to return from this devastating the impacts it's had on their small businesses. So next slide, we can talk a little bit about the bounce back gating criteria. So these are the gating criteria for Badger Bounce Back. One of the things that regionally the health directors talk daily, and we are having a little bit of a hard time at, the Badger Bounce Back does take into account these specific gating criteria measures. What it doesn't take into account, what happens if these buttons go red all of a sudden after we are in a gating criteria that we're okay and we're meeting it. It's kind of like I've heard, Fred, I think, even used the analogy of turning up the dial and turning back the dial. And as we start to reopen, we know we will see more cases. We anticipate that. As Dr. McGinnis pointed out, I'm not sure we even have a really good baseline because part of the Badger bounce back plan is increasing testing. So anybody who has any kind of symptoms or feels like they may have COVID, if they want to test, they should be able to get a test. And we're definitely working with healthcare providers on that. So you can kind of look through those gating criteria. We haven't seen a downward trajectory of influenza-like illness, which that they're using that because it is so similar to what COVID illness is like. And that has to be a 14-day period of that. The syndromic cases is all related to data that is collected straight from our WEDS electronic disease surveillance system at the CDC level, and that is looking good. The downward trajectory of positive tests as a % of total tests within a 14-day period is looking okay. So those are those three gating criteria, really what public health is focused on. I don't want to speak for hospitals, but I have heard some opposition, maybe not opposition the right word, but some maybe contention on the chosen hospital gating criteria. And I think these conversations, I think, are trying to be had at a state level with input from Hospitals Association, DHS, the Wisconsin Emergency Management System. I think they're really trying at the State Emergency Operations Center to have a good plan. But the reality is we really, we've never done this before, and we haven't seen this before, and we don't know what long-term effects this may produce. So next slide, please. Here are the sites that we like to refer people to related to COVID-19, public health, CDC, and the DHS website. The St. Croix County Public Health COVID site is really mostly all just links to the CDC or the DHS website. We do have some of our own data on there. And I know we have a new PIO hired for the county, and Administrator Thompson has assured me he's coming to public health his first day. So we're excited to use him and hopefully really get some better communications out to our partners. On a phone call with the sheriff today, I said, Scott, this is so hard. I feel like I'm missing so many important partners and not including, and who should be on this call and who should be on that call. And I'll be honest, it is getting tough. It is tough. It has been tough, and it's getting tougher, especially as we see people who one positive case this week did not want to cooperate with us. We have the partnership of local law enforcement and sheriff's office to utilize them to make contact with people who are not wanting to share information with us. But, we have the things in place, but yeah, it's a struggle. Next slide.
Help is on the way, Kelly.
I'm so excited. So I heard this quote, and I didn't even know it was Malcolm X who said it, but even illness becomes wellness when the I is replaced with we. And I just love it. And we can use it in so much of our public health work. And we do use that. So I know I went way over probably time, and I'll take any questions, or you can hold questions. However you want to proceed. Thank you guys for your time, and welcome new board members and Bob.
Craig Telejohn. When are we going to see more asymptomatic testing?
So that's the antibody testing I kind of speak of. Although DHS did put out a memo last Friday night, actually, late in the evening, that healthcare providers should be thinking about testing asymptomatic people. I think with the test supplies being at a short supply early on in this epidemic, and still pandemic, I'm sorry, and still currently, it's not going to be widespread right now to test asymptomatic people, but we do have some insight. And if you inside resources, I guess, if you will, we know that there are healthcare facilities that are testing people more readily than others. And then the antibody testing is really, I don't know. Do you have any predictions on that, Dr. McGinnis?
Yeah, no, it's a good guess as to when reliable antibody testing will come out. And then the second huge question is, again, what does it mean? Does it mean that you're now immune and safe, or does it mean that for how long, or maybe even if you have antibodies, you're not safe? And those are the questions that I think we don't have the answer to. I think in reference to Greg's question around asymptomatic testing, I think some of that is coming, but it's being used in very specific circumstances. So say, for instance, say you're a woman coming in to deliver at a hospital, they may test you even though you're asymptomatic. If you're going to have surgery, they may test you again. And some of those things are just beginning to come online. There is some conversation, I think, around some of our elder care facilities and perhaps beginning some routine testing there, because that's a population that's so highly vulnerable. I think the hard part about asymptomatic testing the average citizen is that means that at that point in time, you didn't pick up the virus, but the next day it might be there. So it's not any level of reassurance. And that's the hard piece about this.
When somebody is tested positive, is that report go to county, or does it go to the state then to the county?
So, yep. So it actually, all of our clinic and hospital systems that are based in St. Croix County report into this WEDS that I referred to. So it's the Wisconsin Electronic Disease Surveillance System. And we check that daily. And those positives come up. And I will say we've had positives come as late as 9 o'clock at night. And we do attempt to call those people. I do, the health officer does, if I see a positive after hours. So to answer your question, yes, they go into they're not faxed. The old days, they used to fax them to public health. Now they are part of a shared system that come to us, with the exception of the river.
Kelly, I have that information. The number of contact investigations is 285.
Thanks, Deb. So that means of those 37 positives, public health staff have made 285, did you say? 200?
Yes, 285.
285 calls to do what we call contact tracing. And that is, when you hear in the media contact tracing, we do the initial case investigation with the person who has a positive test, get their information of who they've had contact with, and then categorize those contacts into either a high or medium risk and call all of them.
Any other questions or comments? Dr. McGinnis, did you want to add anything else?
I think there's a lot of hard work that's being done here. And I love the analogy that the state is talking about, which is changing it from March and April, where we were boxing people in, staying at home, and trying to gradually open those boxes, and changing it from a standpoint of letting people out to do what they need to do and want to do, but at the same time then boxing the virus in. And this whole process of contact tracing, rapid testing, and identifying those folks, and then having people who understand that, yep, they're in a risky situation, they need to just hang in there and take that 14 days or 10 days and go into that box so that they're protecting the rest of the community, and especially our businesses and other parts of the community. I think that's the really important thing. So I think the capacity is definitely increased, and we're seeing a lot of good things in Wisconsin, especially when you look at the percent positive number of tests, where testing has definitely increased, but the percentage of positives in Wisconsin has gone down. That means that so far, Wisconsin has been able to flatten that curve, has been successful, and that's the reason we're able to open up some of the small businesses. Hopefully the next stages include other types of businesses and other individual activities. So we'll keep the fingers crossed, and hopefully people can keep helping the economy, helping their neighbors, helping their business owners get back to normal life, or at least as close as we can be in the new world that's coming.
Thank you, and I appreciate your input, sir. And Kelly, please pass on to staff again. You guys and gals are doing a fantastic job. We thank all our partners that you're working with. We are in it together, and we will get through. Fred, you and I had a conversation this afternoon. Do you want to jump in on anything at this point?
Just real briefly, Dr. McGinnis and I did have a conversation earlier today as well. And, you know, the impact of COVID-19, obviously there's a lot of work being done in public health, but specifically Dr. McGinnis asked about the impact with regard to substance abuse, mental health, and our child abuse and neglect services, our children's service division. And maybe, obviously there's been adjustments made, and where we do a lot more work that's remote based, and still some face-to-face contacts with precautions. While we may not necessarily have this as a specific agenda item today, maybe when we get down to some of the orientation plans, it might be a good idea to talk a little bit more about orientation that is pre-COVID. How did we do things before COVID-19 showed up at our doorstep, and how are we doing things now? If the board wants, we can give a couple of quick examples, but just something to keep in mind as we've worked our Health and Human Services pandemic plan to really ramp down, and now as part of the whole county process, how do we begin to look at reopening to some degree? So I guess I would take direction from the board if you want a little bit of detail now, or if that's something that might be just a future agenda item.
Comments from board members? Would you like to hear a little bit now, or want to hold off, or talk about it right when we get down to the orientation process? Let's do it there, Fred. All right.
I'm sorry, it must be my old ears. I can't quite hear what you're referencing, Dave.
I think we'll talk a little bit more about it when we get down to our last item down there with the orientation process, if that's all right.
I didn't catch that either.
Yeah, sorry, it's a bit difficult to hear. Maybe I'll just wait till we get to orientation. Is that what the
Yes, Fred.
The direction is?
Wait until we get to the orientation point on the agenda, and then we'll discuss it.
Ken, this is Pat. The audio in the boardroom is not good. We can hear members that are remote very well, but the members in the boardroom, I don't know if you're using your microphones or not, but the audio in the boardroom is not good.
Okay, we'll try it one more time. We'll talk a little bit more about this when we get down to our last item with the orientation, if that's okay with everybody.
Sounds good.
Got that. Sounds good.
Okay, thank you. And with that, we'll move on to item number 5 and talk about our financial report. Faye.
All right. Good evening. I'm Faye Strinke. I'm the Fiscal Manager for Health and Human Services. Welcome to our new board members. I thought tonight I would give you just a brief overview of how this financial information is kind of structured, what you'll find in here. And then I'll go through some of the financial information in here. So the way this packet is set up is the first 3 pages that are labeled Hhs Overview is a summary of the departments within Health and Human Services. The first 2 columns give us, year-to-date information from 2018, from 2019. And then the next column, the fiscal year 19 actual, year-to-date, that's a summary, a cumulative summary of January through March of 2019. And then we're able to compare that to January through March of 2020. So we're kind of looking at apples to apples when we're looking at where were we at last year at this time, and where are we at this year at this time. The budget amount is our annual budget amount, and then the balance remaining column, is saying just the difference between what we've used so far this year compared to what was budgeted. The remaining structure, the first grouping of numbers is our revenues. Our revenues are broken into 3 primary buckets of money. We have general property taxes, we have state and federal grants, and then we have what we've referred to as local revenues, and that's collections we make from third-party payers and from clients, paying directly for services that they receive. The next grouping of numbers would be salaries and fringes from the staff that are working. And then finally, the next group is our operating expenses. So once we get through, that high level, that's a summary of all the departments. This goes through and breaks it out by each department. So we have that same information for public health, behavioral health, and the rest of the departments within HHS. Later on, we get to an overview again for the health center campus. So this is on page 30, I think, of the report. Again, it's a high level of the campus overall, and then breaks it down into the 3 departments within the health center campus. Then we have a summary for our veterans services. And then the last page of the report is specifically related to purchase services. A lot of expenses within human services are purchase services. So when we're paying for placements for children in out-of-home care, we're paying for hospitalizations, we're paying for residential treatment. CCS is one of our big programs where we're purchasing a lot of contracted services. We sometimes have control over these, sometimes we don't, but they're a huge piece of our budget, so we like to split those out separately for your review. So again, this is just an overview of how this report is structured. One of the things you may notice is we only go through March in this report, and that was because of the lag in how we report some of our revenues. When we were going through April, they weren't fully reported, and so when we were comparing one year to the next, the information wasn't accurate. We may look at changing that now if we go to the 3rd Wednesday, because we may be able to capture that, but that will be, I guess, information will look, or feedback from the board on how they want that information reported to them. With this report now, what I generally do is go through and highlight any areas where we're have significant differences between what we budgeted and what we're reporting. I highlight any trends that I see, or I alert you to any trends, and then answer questions. With this report, everything right now is looking to be right on track for Health and Human Services, for the Health Center campus, and for veterans. What you're going to see in future reports is probably some significant changes in our revenues. As we are in these safer at home orders, the level of service that we're providing has decreased. So our local revenues, where we're collecting from other payers, will be impacted by this. So any questions I can answer for anybody right now?
Faye, for our new board members, could you explain to them a little bit about when we send a bill down to Madison, there's about a 2 months lag when we receive those funds coming back, what that process is?
Yep, I'd be happy to. So one of the buckets of money that I talked about was our state and federal grants. So what happens is, during the month of January, we accumulate all of our expenses. In February, we complete reports and report expenses back to specific state contracts by program. So that, would get reported to them sometime before the end of February. That gets processed, and those payments then would come in March or April to us for those expenses that we incurred way back in January. Different groups of people. So we have Department of Human Services, we have Department of Children and Families, and we have our aging reports. GWAR is one of the ones that we work with at their ADRC. We just received a payment this month for the January expenses that I had reported back in February. So there is a significant lag in money that we receive on our state and federal contracts. Even with some of our year-end reporting, we are still looking at money coming in here during the month of June for some of our 2019 final reconciliations.
So as we go on, it's fair to say that there may be times where we're looking at expenses that look really high compared to what the revenues actually are.
Correct. You'll see, yep. And that's, like I said, where I can alert you to trends if I have concerns that some of those state and federal contracts that we're not going to meet what we're projecting. But for the most part, those usually stay, as long as we have the expenses to support the contracts, that money will come in. It's just a matter of timing for when it comes in.
Okay. Anyone else have any questions?
I do, Chairman Osnes.
Go ahead, Dr. McGinnis.
Yeah, with the current situation that we're in with the virus, obviously, we're seeing a lot more use of public health time and services. As we look forward, and I don't anticipate those needs going away anytime soon, and likely continuing through this year and probably for a good chunk of next year too. Has there been adjustments, or does there need to be additional resources, and are they available for that department and in those areas?
We have been, we had program codes, within our accounting system that we developed to track their time. Public health staff also have a system where they do 100% time reporting. So we are monitoring where their time is being spent. We did bring in extra help right now with Deb and with Sharon. I think that's been mentioned earlier. As resources for this contact tracing. That is something that we're continuously monitoring of. Are we meeting the needs? What are our future needs look like? Do we have staff in other areas that because of changes in how we do business maybe aren't as busy, that they can be utilized in these departments? So we're looking at all options to make sure that we can meet those needs. And then I know the state, again, is looking at how can they allocate funding they receive to help us get through these peak times. And then, what will we do long term? So it's being looked at. I don't know all the answers to them yet.
I can provide a brief comment if I may.
Yeah, go ahead, Fred.
So in the area of contact tracing, earlier this week, we identified 5 additional health and human service staff, plus there's public health staff that have been pulled maybe from their regular duties and are doing the contact tracing. So I know that Kelly mentioned Lori Diaby-Gassama earlier. Lori is working with those 5 staff. I don't know the current status of the training, but we'll have those 5 staff at least for some time as testing ramps up. The second area that Kelly and I have looked at and talked with Pat Thompson, our county administrator, is what's happening with the 1,000 people that the state of Wisconsin is hiring to do contact tracing. And I know there's work being done on how that might help augment some of the, or support some of the local efforts on contact tracing. And then the third phase of that would be looking at this year's budget as well as next year's budget to look at what we might need to do as whether they're temporary positions or continued positions to help support public health. So it's certainly something we continue to talk about and are planning for, but it's starting with staff that are currently have less work to do based on some changes that have been made, look at the state, and then look at long range with additional staff for public health to support.
And just really quickly, Fred said he didn't know where the training was at, or those other 5 HHS staff, and that is occurring tomorrow morning. So we got that going.
Great, thanks, Kelly.
Pat, do you or Ken, either one of you guys want to weigh in on anything at this point with this?
Not at this point, Mr. Chairman. I think Faye answered the question very well about funding, and we're tracking it very closely.
Okay, thank you, Pat. I'm pointing my finger over here at Ken, and Ken is just shaking his head, no, 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 not me. So, okay, I think we're good then. Thank you, Faye, and everybody else for your help on this. We appreciate it.
Thank you.
And we'll move into our final item, which is planning for the new Health and Human Services Board member orientation. Fred.
Yeah, typically, as new board members join the Health and Human Service Board, there's opportunity to have conversations about specific programs, divisions, divisional work. Faye gave a little bit of an overview of some of the financials and how those are reviewed. So it didn't have necessarily a specific plan on how that orientation might take place. It certainly could be a bit challenging with some of the remote work that's happening, or we could certainly, it may not be a challenge, but I just wanted to put out to the board that we are available to provide orientation. We just have to make sure we're following the open meetings and public notice requirements. And we could do that a variety of ways. But as we talked about earlier, one of the things that I think is important to consider is the Health and Human Services Board approved a service delivery plan in February, I believe, and we have typically done that annually. But that plan has been adjusted significantly based on COVID-19. So there may be opportunities to have dialogue about orientation on what we did with services prior to COVID-19 and how we are making those adjustments and what we're seeing with some of those adjustments that have been made. So it's really, we want to hear from you what you would like to do in terms of orientation, and then we can do some planning.
I would like to see some orientation because I have no idea who Faye S is or Deb L is and what they do, and you know, nobody's introduced anybody.
Well, and Greg, with that one of the things we tried to do here in the last couple of years, at each one of our meetings, I tried to have at least a couple people come in from public health, and we had a couple people try to come in from human services end of it and explain really what do they do, what does their staff do, and so we've got.
It'd be nice when we're having a meeting like this to introduce everybody first. I have no clue who's been talking and what they do. I don't know what Paul does, where he came from. So anyway, that's my contention.
No, that's okay, and I got, yeah. Let's back up, and I'm sorry, that's a good point, Greg. Let's start with Kathy. Do you want to introduce yourself? You're one of the new folks on our board.
Sure, I can start. I'm Kathy Leaf, and I am District 4 Supervisor, just elected in April. I live in North Hudson, and I have a husband and a teenage son. I am excited about this committee. I have a passion for public health, and there's no better time, I guess, than to jump into public health service than now, right? Deep into the pool. But I'm looking forward to working with all of you and supporting St. Croix County's good work.
Greg, thank you very much. And I think the assumption was made that people knew each other, and that was erroneous. So Dr. Paul Mckenna, I'm a family medicine practitioner. I worked in Hudson at the clinic for over 32 years, and then retired at the end of 2018 and was asked to become part of this board about a year ago. And so I'm a non-elected appointed member filling a physician membership on the board.
Thank you. Greg Telejohn, District 14 Supervisor, Aaron Prairie, Richmond, and a little bit of Warren Township, and business owner of Digital Garage in Hudson. I should be retired by now, but I'm not. Yeah, Health and Human Services, I'm interested in that, and just trying to get my arms around the whole big thing this is. So, yeah.
Very good. Natasha, you want to tell us a little about yourself as well? Tasha, can you hear me? Okay, she's gone.
Makes some internet issues. Can you hear me now?
You go ahead.
Okay, I'm Natasha Ward. I'm a citizen member and elected as well. I live north of Star Prairie, and I'm the Director of Community Health Improvement at Western Wisconsin Health. And I'm on the leadership team for Healthier Together, which is part of the reason that I'm a part of this board.
I can go. I'm Deb Lindeman. I am a RN, so I'm the RN member, citizen member of the board. I also retired a year and a half ago or so as a health officer for St. Croix County. And I'm back to work now helping out with the COVID response. And our children went to stage door together, Greg.
Ah, okay. That's a long time ago.
It was.
Scotty.
I am Scotty Ard, District 13 New Richmond Supervisor. I am the Housing Navigator, Permanent Supportive Housing Director, Rapid Rehousing Manager, and Emergency Fund Source for the Salvation Army. I have a 7-county area that I cover. Currently, I am responsible for 146 individuals that we have housed for their health, welfare, and safety, as well as any persons that we have in shelter.
It is. I can't do that, but
Go
I'm
ahead,
Paulette Anderson from Hammond, Wisconsin. I've been on this board for the past 6 years, and I'm on my town board. I'm the Community Ed Director for the St. Croix Central School District, and most important, I teach unicycle.
And I'm Dave Osnes from District 10. I'm beginning my 6th term on the county board. This is my 2nd term on this particular board. I've served on the Council on Aging and Disabilities for 6 years. I'm on the WCA Steering Committee on Health and Human Services, and I'm also a member of the GWAR Board of Directors as well, along with WESCAP.
Faye.
Yeah, Faye, tell us a little bit about yourself. You're hiding up there on the top.
Okay. So I am Faye Strenke, Faye S, if you can see my name on the screen. I have been with St. Croix County for 25 years. I started out working in the nursing home, doing bookkeeping for them, and then later became the accounts receivable supervisor, so working for Health and Human Services, doing those third-party collections, supervising the staff who, did the majority of the work for those collections. And then last summer was promoted to the fiscal manager. So I have been in this position, for 10 months and still learning a lot with this. And of course, all kinds of changes here with COVID-19. But again, I'm available to answer any questions you might have, and, we'll present information that you guys need or would find helpful at your meetings. And again, even with your orientation, the financials you get are very high level and summarized. There is lots and lots of detail behind the scenes that I'm monitoring and tracking. And it may be helpful during orientation or some other time for me to get into a way deeper dive so that you can understand the multiple contracts and lines that go into these numbers that you see.
And you're still smiling, and that's good. Steve, we haven't forgot you, sir.
Well, thank you. I'm Steve Curt. I'm the Behavioral Health Administrator and Health and Human Services Operations Manager. I've worked for the county for 27 years, almost 28. I am due to retire on the 12th, so I won't be, now that you moved the meeting to the third Wednesday, I will be saying goodbye tonight. Fred and I both agreed to stay on for an extended period. I was supposed to retire beginning May 1st and agreed to stay on to kind of help out through the COVID. But yeah, that's who I am.
And Steve, we can't again begin to thank you enough for all the 24 years of service that you've given to the county and all the expertise that you bring to the county and to this board as well. We thank you very, very much, sir.
Thanks, Dave.
Who else we want? Pat, or you want to throw a couple words in?
Well, thank you, Dave. I'm Pat Thompson, County Administrator. I've been County Administrator since 2011, and I can't be more proud of the staff that we have at Health and Human Services. And I think the Health and Human Services Board is one of the best Health and Human Services boards in the state, and it's only gotten better with the addition of Deb Lindeman and Dr. McGinnis and Natasha Ward, three great citizen members of our board, and along with our new county board supervisors on the Health and Human Services Board, and Bob Rourke coming in as our new director, Julie Krings as our new operations manager, deputy director. I think, you know, Fred, you've left big shoes to fill, but you've also left, and Steve Curt left big shoes to fill, but you've also left a department in great shape. And I can't thank you enough. And, you know, it's going to be up to Bob and Julie and his team now to keep it going as we pass the baton in a time of transition, but such a serious time to a very serious public health crisis. And, but I think we have the right team in place, Mr. Chairman. I couldn't be more proud as your county administrator to work through this crisis with the board that you have in place with the expertise. And so thank you to Fred and Steve as you transition out, and welcome to Bob. Thank you.
And thank you. Ken?
Hello, this is Ken Witt. I'm the Assistant County Administrator. I'm normally the guy behind the scenes pulling the strings. That's how come you don't see me on the camera. But I've been with the county for 4 years. Next week sometime, I'm sure Pat's got a big party or something planned for me. But thank you.
Colleen, we're not going to forget about you. You're not going to get off that easy.
Hi, I'm Colleen Linder. I'm the Executive Administrative Assistant to the Director. So Bob, you and I will get to know each other pretty well. I am your contact for these meetings most often. If you have information that needs to get to Fred and or Bob, I am your contact. And I will do my best to get the meetings out and the information in the packet. I take the minutes and many other things at this point. Nice to meet you all. Thanks.
Very good, and we thank everybody. For our new folks and the returning folks, Colleen would probably be a good a point of contact for all of us. If you got questions for myself, Bob will be available. I'm sure you can get a hold of him, but Colleen would be a good one to start with if you guys don't mind. Anyone else have any questions? Okay, Fred, you want to go a little bit over the orientation again and what some of your concerns, comments are?
Yeah, sorry, I would be happy to. Maybe one of the things we could do, and Dave, I think you suggested this, is at a future meeting, spend some time talking about all of the various programs, and it may take a little time, and we can prioritize and we can make some adjustments. And part of the reason I say maybe not just focus on new members is back to what we had approved in the service delivery plan. And I believe I forwarded that out to all of the supervisors and citizen members on the board, along with some of our pandemic planning, so we can talk about what the programs typically look like, but also talk about how we've made adjustments. That would be a way over the next couple of months to do that work, to help give the board a good solid foundation as you work towards providing input and feedback on the operational budget for 2021. The other thing that I would offer is we certainly are available for calls, or we could set something up for a Zoom meeting or a Skype meeting that only focused on maybe some areas that individual supervisors, new supervisors might want to have information sooner than later. Those are a couple of suggestions, but again, open to input from the board on how they would want to handle an orientation. I can tell you previously, it was done more informally, where board members contacted myself, coordinated with division administrators to get information to supplement the service delivery plan. But I will stop there, and we can hear feedback from the board.
I think that's an excellent idea, Fred, and because things are changing, and then we can see what was planned and what are the new plans, and if people have things they want to learn more about, there's always things to learn. What I'm wondering, can you folks hear us yet? No. Oh, that'll be fun when I Zoom. So Ken will take care of that, I'm sure.
Fred, this is Pat Thompson. Will you coordinate orientation with Bob as well? I know that his schedule as he transitions into his new role as director will be busy, but whatever orientation sessions take place, we should include Bob as well if his schedule permits.
Oh, absolutely, Pat. Be happy to.
Thank you.
And I agree with you on that one too, Pat. That's a great idea. Any other comments? All right. I will be asking for are there any requests for future agenda items? Okay, hearing none of that. Are there any announcements or correspondence? Fred?
Just one announcement. The federal funding, the CARES funding that has come to the state, I believe that amount is $2 billion. And it is at the discretion of the governor to decide how that funding would be distributed to support the state of Wisconsin. Certainly there's been lots of requests, I'm sure, but counties have made a request. So as we look forward on financial reports, one thing I think is important to keep in mind is that CARES funding and what it might do to help support not only operations within Health and Human Services, but other divisions or departments within the county. I have no other announcements other than typically we've had reports available to the board that talk about wait times for our intoxicated driver program, census data at the health care campus, as well as emergency support beds report from our emergency management department. So those were not an agenda item today, but they can be, I think Colleen made copies if board members would like them. You can grab one at the meeting, or we can have it forwarded to you for your review.
Okay, very good, thank you. And Bob, you've stuck with us faithfully through our first meeting, sir. We look forward to welcoming you and working side by side with you as we move forward.
Thank you.
And with that, our next meeting will be June 17th, 5 p.m., and this meeting is adjourned.